you haven't checked him out yet, he is just such an influential figure, um, and he will change your life if you apply some of his teachings and such. But let's get kind of to the topic of what I want this video to be about. I want to talk a little bit about where or how depression is improperly handled. So we're going to talk about a couple of different things with that. But the key point, I'm just going to kind of lay it out, that part out first, and then we'll kind of divulge into some of the smaller components and subcomponents of those to get down to the real issues here. So basically what happens with depression normally is that, and this is a very broad uh, uh, spectrum I'm addressing right now. I'm not just addressing clinical professionals. I'm also addressing friends, family members, just the natural instinct that we have as humans in our society. So usually people with depression, the people around them that want to help them at least better the health that they're currently in, will normally only try to address the symptoms, right? So you have somebody, let's say you got a really best friend of yours that's having a hard time, difficult time going through a severe depression, and you're trying to help them out of that. Normally what you do is, well, if you're a guy mostly, or a young guy, you'll go to them and you'll say, oh man, you need to go out there and do, these are the things you need to do that'll make you happier, right? And they don't necessarily have any correlation to the real reason as to why they're depressed, right? So, and you see this across the board with a whole bunch, probably all mental disabilities, whether it be anxiety, depression, whatever it is, ADHD, adult ADHD, is they're always treating the symptoms and never the core issue. And the reason for that is mainly because a lot of these core issues of people, like, here's how depression starts, basically. Depression and anxiety mostly. You'll have little experiences, little things happen to you throughout your life. And everybody is born with certain mental susceptibilities from birth, normally. There's kind of basically two ways I see it happening. That are two roads that have the potential for utter chaos in somebody's life, and it's people are born genetically with um, different vulnerabilities in their psyche. So um, if somebody with a vulnerability to, let's say, anger or rage situations, they may have an experience at some point in their lives, normally in early childhood or early adolescence, where they'll have a very, at least traumatizing to them, situation uh, in relation to their specific susceptibilities. So somebody with an acute uh, vulnerability or uh, to like a rage situation, maybe their parents or somebody around them has some kind of issue happen and they get very, very angry, start screaming at them, and all of a sudden that person is now scarred for life. And the reason for that is because there's these certain things that people are definitely afraid of for a numerous amount of reasons. And they're normally not afraid of whatever it is they're acting like they're afraid of. They normally are afraid of something else much, much deeper. And the only person that can uncover that is the person themselves, because they must dive deep within them and really try to get outside of all of their biases and such and really dive into what the problem is. Because a lot of the times what we do subconsciously completely without even knowing it is we justify um, the falsehoods that we teach and practice in our lives. That happens with everyone. Everyone does that. It's just, more prevalent in people that have accruing amounts of chaos in their life than it is that others who are more fortunate. And then the other way I normally see it going is you actually have something deeply traumatizing that happens with no mental susceptibility. So if you are actually raped or something like that, and you have something very traumatic such as that happen, or maybe a close member of the family was murdered or something very, very horrible. And there's, horrible situations are usually non-escapable. There's things you can do to prevent them things from happening, but most of the time they happen, and there's really nothing in most cases that you can do about it except address what it is that's bothering you and take care of it, just like the other situations. So those are the two basic situations that I see in terms of how depression starts. And as I alluded to in the first part of the video, that's the problem. The problem with it is that people, uh, even clinical professionals, they're really bad about it. People don't understand, and not all of them are that way, of course, but at least in my personal experiences and the personal experiences of the ones close to me, I'm seeing clinical professionals do far more harm than they even understand or realize. Now, I know of a specific individual um, that had these mental susceptibilities genetically, had certain things happen to them across their life that uh, caused this, and also traumatic events as well that would have harmed anybody, so set up for a lot of chaos in that particular area. And he went on and he sought clinical help. The clinical help that he was given was a misdiagnosis, and whenever the uh, eventual uh, side effects came from the medicine from the misdiagnosis that he did not need, which of course was going to happen. Um, they kept piling on drugs they kept giving him drugs to treat the side effects of the misdiagnosed drug they were giving him to begin with. So what you ended up with was a just cascade of a cascading descent into hell, far more than it's even possible to comprehend. And that, of course, led to the individual. That started at about age 20 and led to the individual being about 50 years old and being on disability for 20 plus years, and once you get that far down, it is extremely hard to come back. However, the individual seems to be making a rapid comeback due to these principles. You have the key principle behind it all is to be truthful and honest with yourself. And one thing too, the video is getting kind of long now. I'll close it with this, and I can go more in depth with these videos if you guys would like, but just let me know in the comments and like and subscribe. Tell people about me. I'm going to be doing a lot more in a lot different areas with these kind of topics. But last thing I'll say with the depression and how they go wrong with it is that getting into the mindset of somebody who is depressed, oftentimes here's where the reasoning behind depression through the eyes of the victim is wrong. Is that they typically have absolutely zero problem with seeing the evil within themselves, right? That's all they see. That's the problem. And a lot of people think, well, you just need to see the good in yourself and realize that you're better than this person, this person, this person. You're a value member of society because you're above these other people. Wrong. You're not above anyone. But here's where they can improve. All right? You don't see the good in yourself to treat depression because it's a falsehood and it will ultimately lead to relapse. You see just how horrible everyone else is as well. That's the key. You are indeed evil and capable of more evil than you possibly can comprehend. Every evil act that was ever committed by a human being, you are capable of doing under a certain set of circumstances. Now, with that being said, everybody else is as well. So, keep that in mind. The road to um, successfully apprehending depression is not realizing how good you are. It's realizing how terribly bad everybody else is just as you are. And I'm gonna end it with that, guys. Just let me know what you like, how you feel about this video. Leave stuff in the comments. I'll see you guys next time.